Hi there, Dr. Eric here. Today I want to talk about emotional health and well-being as a veterinarian. Now, I think it's pretty common knowledge that veterinarians are among one of the highest ranked professions as far as suicide rate goes. And that's obviously very, very sad. And I think I want to kind of explain or dive into why veterinarians face so many struggles and why so many veterinarians face depression. I think part of the problem is that we are type A personalities. That means we are go-getters, we're overachievers, we're perfectionists, maybe we take on a little too much, we just try to strive to be perfect all the time. And now in medicine, whether it's veterinary medicine or human medicine, you're not going to win every single time, and things are not always perfect or don't always fit as neat and cleanly as it might suggest in the textbook. Some cases don't respond the way that the textbook says they will. There might be genetic factors that we're not aware of, or history that we're not aware of, or whatever the case is. Some things don't always go as well as hoped. And that, as far as perfectionist or any kind of type A personality, very difficult to get over, especially once we're really involved and committed in a case. Sometimes those cases really stick with us, and the longer you practice, the more those cases that stick with you kind of weigh you down, and that can really ride on a lot of people, or take a toll on a lot of people. One of the other things is that veterinarians, especially straight coming out of school, have a very high school loan. Veterinary school is extremely expensive. It's only getting more expensive. Unfortunately, salaries are not keeping up as high as the school loans are going up. So there's a sort of an upside down debt to income ratio that a lot of people may not be aware of. One of the other things is maybe a disconnect between owner perception and veterinary either motives or reality. One being, you're a veterinarian, you love animals. That means you should be able to take care of my dog for free. Well, yes, we do absolutely love animals, but no, unfortunately, we can't take care of your animal for free because all these things cost money. The education costs a lot of money. The nice facility that is welcoming and has equipment and a knowledgeable, friendly, kind staff, and caring staff, that costs money. We have to, be able to pay our employees. We have to be able to put food on our own tables, and we have our own bills to pay. And if we can't take in money for the hospital, we can't help anybody. So, unfortunately, this is not a business where we can, give things away for free, as a lot of people might think that we could. Sometimes that gets perceived as veterinarians only care about money. They didn't help my pet because they only care about money, and that's a very unfortunate perception, but it's very untrue. What's actually happening is that veterinarians probably taking a methodical thought process through a case and trying to gather as much information in the most efficient way possible. The shortest amount of time, the shortest amount of money spent, but tests do cost money. Some things may need to be revisited, so you have to come in for multiple exams sometimes, or visits and additional tests. But that's not the veterinarian trying to get more money. It's just trying to be thorough and work through a case efficiently in a way that doesn't spend all your money right up front running any kind of test, but also prevents us from starting tests or treatments that may be not only unnecessary or expensive or harmful. So there's a thought process that goes along with the exams and how we approach a case that people may not be familiar with. One of the other things that or one of the biggest things that veterinarians also are tasked with is the responsibility of euthanasia. Now, euthanasia is not only, or it's a blessing and a curse. Now, being able to end ultimate suffering is one of the kindest things we can do for our loved animals. However, it's still a very heavy burden that sticks with us for a very long time. Knowing when to recommend that, when to sort of say, you know what, this is not the right time. There's still a lot more that we can do that's reasonable for the animal, for the family. We have to consider things like quality of life, again, not only for the animal, but for the family as well. These are all sort of considerations, but euthanasia itself is never recommended lightly. However, even when it's the right thing to do, sometimes it's very, it will take a toll on you, no matter how many times you've been through it. And that certainly can stick with veterinarians for a very long time. Sometimes cases, certain cases, whether they hit home for a particular reason, or maybe they start second guessing themselves. Again, trying to be perfect in imperfect situations. They're trying to think, well, what should I have done instead? Or was there something else that could have been tried or tested or recommended? Even if everything that had been done was completely appropriate and up to code or up to standards, sometimes it's and things still go south. Sometimes it's still tough to kind of get over. Unfortunately, when things go south and people are unhappy, especially in the day of social media and Google and everything, people write reviews, and if things didn't go well, whether it's really the veterinarian's fault or not, a lot of people will take their frustrations out on that veterinarian and will kind of blast them on social media. This is actually bullying. The veterinarian is trying to be thorough and recommended certain tests and should be recommending options as far as best level of care kind of medicine versus either a next best step approach versus either referral or euthanasia when it's appropriate. And sometimes the only ways, especially the complex, very severe cases, the only way to help the animal is either all in very aggressive, however very expensive tests and treatments to find out what's going on and to manage a critically ill patient, or euthanize, and anywhere in the middle is just prolonging suffering. But people don't always see that way. And then if it doesn't go well, or if the owners can't afford it and the pet unfortunately dies, the veterinarian gets blamed. Whether that animal had been showing clinical signs for months ahead of time before he even presented to the veterinarian, as some cases happen. Sometimes it's out of the veterinarian's control that cases don't always go well. But people don't always see it that way, unfortunately. And then they get blasted on social media. So then other people might read that, not knowing all the facts, and sometimes reviews can go very, very far in the internet abyss, and can really hurt a veterinarian's reputation, hurt the business, and that can take a huge toll on the veterinarian's livelihood, ability to provide for their family and pay their staff and all these things. just because one person wrote this nasty comment, which may not have divulged all the true information, but people will read reviews and believe them, and it kind of gets out of hand. So for those reasons, our type A personality, the heavy burden of having to know when to euthanize pets and being able to do it in a loving, caring way every single time, and the burden of school loans and having to provide for your family despite people wanting free vet care and all these things can be very tricky. So I think, long story short, things that can be helpful to your veterinarian is say please and thank you, be kind. A lot of times I think it's more the rule than the exception is that veterinarians are probably not getting lunch. They're probably working through lunches. A lot of veterinarians use lunchtime to do their surgeries or to do any other, work up big cases kind of thing, and then stay late. The work-life balance is not always the friendliest in this profession. If you have concerns as far as how a case went, call your veterinarian, talk about it with them. They're the best one to talk about it with. And you can have a discussion as far as why certain things were done the way that they were done. If you would like things to be handled a little bit differently, I think having a dialogue with your veterinarian is the best way to go. Cool, calm way. You could have either over the phone or sometimes in the exam room might be better when you're sitting down, level eye field, and telling them how you feel, and we can kind of explain the disease process and why we may have recommended certain things or why something may not have gone well. So I think at the end of the day, it's just being kind and just being aware of some of these struggles that veterinarians face. Maybe might help lower that suicide rate and might actually save a life. So be kind, say thank you, and hug a veterinarian. All right, cheers.